my latest podcast, which today is being held at Cheadle Health Centre, a very busy health centre adjacent to a GP practice. We run here the full range of district nursing services, podiatry services and health visitors. And I wanted to be here today for two reasons. One was the recent Healthier Together decision, which is going to mean much improved primary care services, offering across Greater Manchester 7 days a week service. But also it's about integrated care services, and that's important in Stockport. We are part of a programme called Stockport Together, which is a partnership with the council, with the clinical commissioning group, with Pennine Care Services, who run mental health services, and ourselves. And that's actually about providing the very best of integrated care, which will mean that patients, particularly those perhaps with a long-term condition, can have those conditions managed as close as possible to their home in community settings such as these, rather than having to go to hospital for some of their care. With regard to the Healthier Together decision, this was made by something called the Committees in Common, which is a group made up of the 12 clinical commissioning groups across Greater Manchester. And they've already looked at primary care services and integrated care services, but earlier in the month they were making a decision about hospital care. And this was around abdominal emergency surgery and emergency medicine. What it means is that there are going to be fewer main hospital sites that will be providing that kind of care. But the way in which it means that the entire population of Greater Manchester will receive better care, hopefully saving around 300 lives a year, is that all the hospitals are going to be working together in something called single services. In the southeast of Greater Manchester, we in Stockport will be providing the lead on those services, but working very much in partnership with Tameside General Hospital and Macclesfield Hospital to ensure that those services are provided against quite stringent Healthier Together standards. Another excellent part of the care that we're providing in Stockport, very much in partnership with primary care, is around cancer services. And we were delighted to hear that we are now the 5th best across 211 districts across the country for providing cancer services and 1 year survivorship. Now that's because we are able through primary care to refer patients quickly in for the necessary diagnosis and treatment, and in Stockport at Stepping Hill Hospital we then provide that very same diagnosis and surgical treatments. This is something that we want to do even better at in the future, but it's good to know that year on year we've been improving our care in this area. Unfortunately, in some other areas we're still struggling, and accident and emergency is an area where we're doing much better in terms of the 4-hour standard for patients to be seen and either admitted or discharged. But we're not able to do that on a sustainable basis, and some days, unfortunately, if you arrive as a patient into accident and emergency, you may be having to wait longer than other days. We've got a lot of plans that we're continuing to put in place to try and smooth out that position to mean that on most days our patients will get the very best of access. Other areas that we are still trying to work on is some of our outpatient waiting times, our cancer waiting times against the referral pathways, and also in terms of communication, the discharge letters and the letters back to GPs from an outpatient clinic. We're doing better, but the issue is we need to do even better still. We've got a new member of staff who is going to be joining the executive team. His name is Feroz Patel, and he has been working in Blackpool Teaching Hospital until he starts with us at the beginning of August. It will be great to have Feroz as part of the team, but I did want to say a huge thank you to Kevin Howells, who has been our interim Director of Finance, who has been a real boost to us. Bill Gregory having left the organisation at the end of January, and he is now working in Lancashire Care. We understand that Bill is doing well. We wish the very best to Kevin, and we're looking forward to Feros. Our volunteers at the hospital are around 400 strong, and they are a real asset to us. And it was great to be able to celebrate with 21 different volunteers their long service awards, which between them amounted to 170 years of service. Thank you so much to our volunteers. They're a really important part of our care, and if you are interested at all in volunteering in the hospital, and we can cater for almost any time or day of the week, then please contact Sally Cassini, who is our Voluntary Services Manager, and she will be able to help you with details. Thank you to our volunteers. And finally, I'm really pleased to end in yet another award for one of our staff, Jean Woods, and she has won the Dignity in Care category at the Great British Care Awards. You might remember from a previous podcast of mine that she'd already won against the North West people she was competing with. Jean is a complete treasure, and she always goes beyond the call of duty. One of the interesting stories was where after she'd finished a busy shift, she actually then took a member of the people she'd been cared for home with her. And Jean particularly focuses in on caring for people with learning disabilities. She's a shining example to all of our staff. Thank you very much, Jean.